Right. Today also discuss about the intracranial pressure. The patient is positioned on a bed, the head elevated 30 degree. When the intracranial pressure go up, the patient's body stiffs. This is the body stiff method. It can happen. Why it is happen? The intracranial pressure compress the cortex, the cortical area. This is cortex most important because of the motor aspect or sensory aspect. The motor aspect of the cortex compress. The homuncles, we know the homuncles compress. Due to this cortex compression, this is the decortical compression position. When the decortical compression position identify the flex arm and extends medial rotated legs. Not only that, I'm talking about to the rural area hospital. A lot of doctors and various consultants are not in there. Our hospital also same. Then how we can identify the intracranial pressure go up this patient. The intracranial pressure go up in this area. We know the inside the brain there are a lot of main blood circulation supply of the brain. This is the lot of blood connects venous and arterial area. There are a lot of area inside the brain. And CSA fluid, another liquid thing, CSA fluid also the inside the brain. Then inside the brain there are a lot of organs, nuclei and cortex, thalami, axons, and go through the medulla, spinal, thalamic supply, and sensory supply to the thalamic, and motor supply to the cortex to the down spinal cord supply. There are a lot of axons and nuclei inside some form of spaces related some cells, and also a lot of they are inside the brain. So mainly we divide these things: the blood, then CSF fluid, and brain cells. When the intracranial pressure go high, there are some form of small name about these three inside the brain, some form of volume and volume high inside the brain. Due to this volume high inside the brain, central perfusion pressure also go high. They can't give the blood supply to the internal cells and internal organs. Due to this reason, the cerebral perfusion pressure go high. Due to this cerebral perfusion pressure go high, the brain cells try to take a lot of blood to the cell, and they give the signal to the heart the systolic volume high and give a lot of blood to the brain area. The main arterial supply, systolic supply, go high. Due to this reason, another signal gave to the vagus nerve or carotid supply, the barotis receptor also they give the supply. The external artery compression method applied to the body. This blood, CSF fluid and brain cells, these three we concern the special name Monroe Kelly. The Monroe Kelly hypothesis is the name blood, CSF and brain cells inside the brain. They are damaging to the intracranial pressure high due to volume up inside the brain. Right? It is the some form of happening inside the brain. I am going to explain these things to the some form of idea about this thing. When the signal, this is intracranial pressure high of the brain, due to this reason, another signal is the vomiting. The vomiting is that of this patient. Then the another things, the diarrhea or constipation. This is the constipation happening to the patient, not the internal fluid go out. Internal fluid go out. This is the diarrhea happening. It is the positive things to the patients cure quickly. Then the constipation happening, no lot of fluid excrete on the body, a lot of fluid installed in the brain area. Another small things we can apply to the external head area. This is head area. The volume of the inside brain, how we can reduce the internal volume. The body mechanism are the irregular breathing pattern activate, the systolic blood circulation activate to the brain, but heart is the go down, bradycardia. The heart is the bradycardia method supply to the circulation. Due to this reason, the inside the brain area, lot of fluid collect. When we can in the bed, we can firmly head massage activate. Firmly head massage activate. Firmly head massage. The firmly and superficially we can activate the head massage like 1 hour. Then the venous return and venous return blood coming downwardly and coming to the heart due to venous circulation supply activate and blood come to the drainage to the downward. Then the inside the brain fluid go down. That's the most important another thing. firmly head massage activate 1 hour, the downward go to the fluid and head inside the head some form of release. Another thing we can to tackle another point to the when the patient try to some form of take the sitting position, we can see the neck is stiff. That's also the another important thing. The neck is stiff when the patient again to the pillow. The neck is bent, a lot of bent neck. Then we can take the identify the intracranial pressure. Go high and continuously it's steady brain. Another thing. Uh, some form of another thing. The body temperature, the head temperature high when we touch the head temperature high, the lower area temperature down. How we can balance these two things? The head temperature high, we can apply the cooling method of the head area. This is body temperature down, we can apply some form of dressing method, some form of curtain covering method to the body side temperature go high due to this covering of the downward area. This is the cooling method. We can fan and AC method to apply to the head and temperature also they go down. Then the fever also the continuously gradually downward. This is the another point to temperature balance. Right. Then we are going to the some form of things name. This is the special name we are talking to the Cousins. The Cousins tried. The Cousins tried system when the intracranial pressure high. The Cousins tried method also we can identify this patient. It's also the intracranial pressure go up. Due to this reason, the supply the heart rate grow down. This is the bradycardia. Bradycardia activate. The sympathetic and vagus nerve, parasympathetic method, sympathetic, parasympathetic method, and vagus nerve supply, and the main carotid arterial baroreceptors and heart baroreceptors, lot of are activated to and give the signal to the heart rate gradually down. Because respiratory method also the irregular. Due to this reason, oxygen supply of the brain, O2 supply is the problem. CO2 also the high inside the brain. Due to these reasons, the bradycardia activate. But the internal organ inside the brain, they like to metabolic and catabolic activate inside the brain. Then supply of the systolic arterial supply go high. Systolic arterial supply go high. The cruising triad methods is the heart rate low, the systolic arterial supply go high, and then irregular respiratory system, irregular respiratory system activity. This is the cruising tried method. We can identify the intracranial pressure go high and continuously it's stay the brain. We can identify the heart rate and supply of the systolic blood and irregular respiratory method. These three, the therapists and doctors can identify the this patient having some form of intracranial pressure go up, go up, and he gradually come to the threatening area. Due to this reason, it gradually come the threatening area. Vomiting also that activates the diarrhea, also that activates temperature, also the difference, neck stiff also the we can see the eyes also the closed because of the dilation problem inside the third cranial nerve compression. Right, the conscious level also the go down. Then we can see the restlessness, the drowsiness, agitation of these patients, and stiff legs and hand. This is the decortical method we identify. Right in this situation, come to the next point. They go into the some form of several time. The intracranial pressure go high, and go high. Due to this reason, what happened to the next? The fit seizure, epilepsy, fit seizure. Then we can see these patients intracranial pressure high is on the now the bed. Gradually intracranial pressure high. The vomiting, diarrhea also the activate. The hand also the twist. Due to this reason, the next time what happening? Fit convulsion activate. This patient, the shivering and stop again shivering and the fit can be seen this patient. This is the life threatening point coming to this patient. That time also the some form of IV supply give the reduction of the brain inflammation and reduction of the brain volume reduction method, the fluid drainage method, the micturations and sweating and diarrhea, and the sun we can apply because of the small hospital can't apply the suns and can't blowhole apply. This is the most important to this patient shift to the advanced hospital. There's another things. Then try to the next points. The visa activate. Then the patient come to the threatening area. We can see the next level of this patient. This is the patient head raise, neck, so body. The now his hand also the go the like this and twist downwardly, and leg also the extend and fully extend, and plant affects the area. This is the hand. Right, now the patient come to the next level. This is the cerebral compression level. They come to the downward pressure, and this is the cerebral area. The decerebellar, the decerebellar herniation time. This is the decerebral herniation time come to this time also the most difficult because of the 12th cranial nerve also the gradually damaged, and the heart rate and the respiratory system and the vagus nerve also the damage. A lot of are happening to the cerebellum, decerebellum situation. When this situation hands beside the abdomen and twist the distal farm and twist and leg also the extend and plantar flex and fit all body to the cerebral time. Right? Sometimes this patient the position this 30 degree, he correct the gradually. The we can see that he open the eyes and body is stiff, go clear and go downward and he is free. Then he can see the some form of thing. Then he can identify the face and he can talk and close go coma is go upward, and then patient come to the cure position. That's the most important another thing. Right, in this situation we are talking these things. Why we are talking about these things is the most important to identify the some form of accident happening to the road. This is the head injury happening to the road accident. Due to this road accident, a lot of patient take to the near hospital. This hospital also no proper facilities, but the doctors must identify with this patient having the intracranial problem, this patient having some form of intracranial pressure increase. Due to proper understand about this patient, the doctors can cure and this patient and correct his brain intracranial pressure, reduce gradually. Why talk about this situation? When a lot of the rural area hospitals, they have some form of X-ray, have some form of CT scan, and have some form of consultants and doctors and the proper management situation not of this hospital. The in this hospital therapists also the must identify with this situation, then we can cure this patient and we can survival his life. That's the most important thing. Right, now we are going to the another small things about this intracranial pressure. Right, the drawing this picture also the another small picture about this. This is the skull. This is the cortex. This is the cutoff of the sagittal coronal cutoff. The coronal cutoff. This is the We can identify the two hemisphere. This is the hemisphere, two hemisphere. Brain stem, midbrain, pons, medulla, the spinal cord, and cerebellum area. The skull, this is of the skull. Foramen magna, this is the tentorial, to separate the two part, tentorial. This is the bone. Temporal region, bone connect to the sphenoid bone and temporal bone. This is the midline of the brain. Cingulate compression area, the middle compression area. This is the lateral cortex compression area. It's the singular gyrus. This is the ankle herniation, downward, and cerebellar herniation. We discuss these things. Now we are going to the some form of lesion inside the brain. This is the lesion inside the brain. The occupying lesion happening inside the brain due to middle cerebral arterial damage. Right, this is the damage. Middle cerebral arterial damage. The occupying lesion inside the brain. This is also some form of hemorrhage or ischemic stroke, ischemic circulation reduction of this area. Due to this damage, then the compression happening to the, what is the area? This side also the compression can happen. This is the cortex compressed to the skull. And midline can be the go this side. The singular gyrus also the compressed can be happen. This is also these are the go downward and middle area go sideward and downward. This ankle herniation also can happen. While we are talking about this inside damage, this can be the hemorrhage, the ischemic stroke, can be happening some form of inflammation. The meningeal problem, meningitis, encephalitis also can be happening. While we are talking about this situation, this is most important to the compression to the skull motor cortex area. Due to this reason, we can see the patients, the hand and leg, some form of hand and leg, opposite side of the hand and leg, paralysis or movement reduction. This is some form of first sign and syndrome. We can tackle these lesions, this occupying lesion. When the small child, we consider the small child as the important another point. The small child, the small child, small child is in some form of 3 year or 5 year. Likewise, sometimes the mother can tackle the 3 year, 5 year time. The mother can tackle some form of shivering of the hand or shivering of the leg, some form of activity doing to the this child, uh, age 3 or 5, shivering of the hand. And I also the notice some form of dilation the pupil and not properly contact the eye. So eye problem also the happen in this time. And this baby have the delivery time postnatal time. The bilirubin problem, he having the bilirubin, the bile problem, the bilirubin problem, HB reduction problem, is the HB reduce, or some form of jaundice, jaundice or lactases, jaundice or the hypobilirubemia, hyperbilirubemia. Likewise, some form of condition happening to the, it is affect to the brain. That is the most important point. It is affect to the brain some form of 3 year, 5 year. This child, the temperature go high, the fully fever, 3 days, 5 days, and convulsion activate to the after 3 5 days, and vomiting can be happen. This is the emergency time to the 3 years. Due to this, the bilirubin problem, the HB reduction also the most important. The tracker. This child also the postnatal deliver the some form of color changing. The natal time, his body color is the some form of the white and yellow color body. The photo light apply the 3 5 days. Due to this ration, the after 3 5 years can be happening inside the brain some form of lesion or some form of attack to the bile, the bile attack to the bile method to the central nerve system. These are the most important to the discuss about this session, some form of damage inside the brain. Right, now we are conclude this session the some form of little bit things, uh, then the herniation, and then the what is the main sign and symptoms we can identify the cranial damage, intracranial damage, the road traffic accident. This is the most important, the road traffic accident, the intracranial pressure identification. It is most important. The worst of this intracranial pressure, that we can see the patients, the CSF fluid or blood out of the brain. That is the problem. That is the major problem. The CSF fluid out of the this is the nose and mouth and neck stiff is the most important thing. This is the mouth and nose and head. The intracranial pressure high and high and high and go high. Come out the CSF fluid from the nose or from the ear. That is the most important. Another sign and syndrome. The CSF fluid out of the ear and nose. Can be blood also come the nose and ear. There is also some form of worse situation. That this patient can blow hole and release the brain. Sometime we can cut off the brain skull, some form of the focal area, cut off the brain skull, and we can release the pressure of the inside. Right, that is also the important thing we have to discuss. Right, okay, we conclude this session now.